Hello, my name is Dr. Aaron LeBauer from LeBauer Physical Therapy in Greensboro, North Carolina. Today I'm going to teach you how to perform some self-myofascial release techniques using an inflatable ball. Inflatable balls can be purchased at your local department store, drugstore, or grocery store, and usually you'll find them in the kids section. Sometimes they'll have Spider-Man or Dora the Explorer on them, but most importantly they'll have a valve on the back side where you can inflate or deflate the ball. That's important because if we're using the ball on the bone or edges of the bone or attachment to the muscle or places that may be really sensitive, you want it to have a little give so that you can stay on the ball for a long time and wait for your body to let go. Balls come in many shapes and sizes. Most of you know about tennis balls. Sometimes they're just a little too hard for what we're going to do. You may also find an all ball, which is a really thick vinyl ball. That's more of a therapy ball. It's sometimes yellow, green, or blue. And then this is a 10 centimeter Sensi ball. It's got little nubs on it. They can feel really nice, but the nubs aren't necessarily important. Next, I'm going to show you and demonstrate for you some typical techniques that I teach my patients in the clinic. Myofascial release is a very safe and gentle technique. If at any time something doesn't feel right, you have my permission to stop what you're doing. What I want you to do is find a nice, comfortable, and quiet place in your house where you have a nice carpet and some space to get on the floor and move around. So take your ball and lay back down on your back. We're going to start with the upper back. So you put your ball behind you, right on the spine, right about a bra strap level or your mid-back level. And you lay back gently. And you want the ball right in the middle of your back on the spine to start with. And you're going to lay your hands out with the palms facing up. And you might need to move around and adjust until you find just the right spot or the place that feels good. Take a couple deep breaths and allow your body to let go. If after 30 to 45 seconds you don't feel like your body's letting go or that you're too tense, you might need a pillow under your head or even put a blanket down so that there's more give to the ball and the surface that you're laying on. You can also put the ball between your shoulder blades in some of the other areas where you have pain, tension, tenderness, or tightness. What you're going to do is find the place that you want to be in and spend 3 to 5 minutes here, sinking into the floor and allowing your body to let go. Okay, next most common place people have pain is in the low back. So you just put the ball in your low back. You might need to move around and find the spots that feel tender, tight, hard. And when you find the right position with your body, close your eyes, take a deep breath, and spend 3 to 5 minutes there waiting for the tissue to let go and to soften. It can take up to 90 to 120 seconds to really get a deep release and allow the restrictions in your body time to let go, time to rehydrate, and time to relieve some of the pain that you're having. Okay, next you can move on to your hip. You just kind of put the ball right into the middle of the glutes. And here, again, you might need to move around until you find the place that feels most tender. Or you can also lift your knee up and let your knee fall out to the side to allow the glute maximus to shorten and get the ball to some of the deeper rotators of your hip. Now this should feel really good, but it can also be very, very tender here. So you want to spend another 3 to 5 minutes in this position, just allowing your body time to let go. And next we're going to move to the front of the body, where the front of the back, or the psoas, hip flexor muscles, or also to the pecs. These are very important areas to work on, but somewhat indirect to where most people feel pain or tension. So you're going to find a nice position on the floor, on your stomach. To work on your pecs, it's best to have the ball directly on the skin. So you may need to put the ball under your t-shirt. And you put the ball below your collarbone, off to the side of your sternum, which is right here, and right into the belly of the muscle. You can make a fist and put your forehead on your fist. You take your arm on that same side and you put it out to the side and you move it up and down until you find the position or place that feels the tightest and most tender. You take a deep breath and you just allow your body to sink in and give it 3 to 5 minutes here. And as the release is happening, you may feel like you need to readjust, move slightly to maintain the pressure or tension on the tissue. Okay. To treat your iliopsoas or hip flexor, find your belly button, take the ball an inch to the side and an inch or two down towards your feet. And then you lay on your stomach. And this is going to be a little tender, may feel a little awkward, but all the important stuff is going to move out of the way and allow the ball to sink in to treat the front of your back. If for any reason this isn't really tender, try this on a comforter or even on your bed. And make sure you spend at least 3 to 5 minutes here. When you're done, get up really slowly. When you're on your back using the ball, make sure you roll onto your side. Spend a few minutes on your side before you sit up. I hope you've enjoyed these self-treatment techniques and that they've been helpful for you. Please visit our website, LeBauerPT.com, for more information and to buy a ball, such as the All Ball, or the Myofascial Stretching Book. You can go to the link for the Myofascial Stretching Book. And this is a great book to treat yourself, and it teaches you how to work through very specific areas throughout your whole body. You can work front to back or target the chapter for the area of your body that you're having difficulty with. If at any time with these techniques that something doesn't feel right, you have my permission to stop. If you feel like you have more questions or need more information or things just aren't feeling right, please visit your local physical therapist for a thorough evaluation. It's typical after treating yourself with a ball and using myofascial release techniques to feel sore the next day, to feel like your symptoms are getting a little bit worse. And that means you're getting into the right tissue, but sometimes you need professional help. Please visit your local physical therapist if you have any further questions.